Welcome to the Private Parts of Wellness. I'm Jessica Bodonsky, your host, and we're diving into the hidden, messy sides of life. Sex, hormones, aging, science, and yeah, a bit of woo-woo too. We're here to embrace imperfections and push back on shame. Growth is messy, and that's where the magic lies. Heads up. I don't hold back on language, so keep those earbuds handy if you're around kids or at work. And a quick note, while I am a nurse practitioner, I'm not your nurse practitioner. Be sure to check with your healthcare team before making any changes. All right, let's talk about some private parts. Welcome to Private Parts of Wellness. And the private parts I want to talk about today are maybe my most political private parts or private thought. And maybe they won't be so political to you. But I want to talk about, or I'm going to talk about, gender-affirming care. So when we think of gender-affirming care, do you know what I'm talking about? I'm talking about taking hormones. And when we think about gender-affirming care, there's a lot of conversation about trans people. And you can think of trans people as transgender, transsexual, and that becomes a whole situation as well. And I'm not going to speak to the different terms and where they come from and what they're about. But when I think of gender-affirming therapy, I first used to think of care for those people who wanted to have their bodies reflect the gender that they felt most aligned to, or what used to be changing their sex. So people who are born male, and if I say feel, please understand it's just a lack of language. It's not a judgment. It's just, I have no notes and I'm doing this off the top of my head. So have some grace. So when I'm talking about gender-affirming care, the idea of gender-affirming care is that you are taking medicines in order to align to the gender that you are. So you may be born a male assigned at birth is what we talk about. That's the language we use in medicine. And you are taking hormones in order to align to your gender identity, which is female. Now, I'm not going to get into the non-binary of it all. We're just going to keep it simple. But the thing is that we are in this time where gender-affirming care and gender-affirming care is going to possibly be very restricted, if not limited. And here's where it becomes political. You may agree with this and think gender-affirming care is whatever the fuck you think about it. But I use gender-affirming care. Now, my sex assigned at birth is female. I am an older female in the later stages of perimenopause. I take hormones. And that care is very affirming to my gender. I take estrogen, I take progesterone, and I take a little bit of testosterone. And that's very affirming care to my gender. Before I started on my own hormonal journey, I was taking care of men assigned or people assigned male at birth that were sometimes younger, sometimes older, But basically, their balls didn't work and they started testosterone because that is gender affirming care for them. And it's interesting because we don't think about hormones and all of the hormones in just the human body. So we're all born with the ability, and let's just talk about like a 21-year-old or a 13-year-old or a 14-year-old, a kid even. All people have estradiol, which is the strongest form of estrogen. It's the most abundant form for me, or was. It's not anymore unless I give it to myself. Estradiol, it's a type of estrogen, right? Most abundant form. I've said it, but I'm going to say it again. We all have testosterone, okay? And testosterone is this hormone that makes us think in a particular linear way for a lot of people. It helps with bone density. It helps with anemia, meaning red blood cells, and it helps with libido. We all have a libido. I hope, whether it's like diminished, whether it's elevated, whether we choose to ignore it or don't really acknowledge it at all, whatever that is, there's a spectrum, right? Testosterone. So we all have estrogen, we all have testosterone, we all have progesterone. Now, obviously, progestation, that's what progesterone means. Those of us who have follicles and then they open and eggs come out, and we're talking about ovaries, we're talking about periods, we're talking about that fertility journey. We, of course, have a very abundant amount at certain times of the month. But the point is, and just to be a little more specific, when you're doing hormonal care, gender affirming care for people in menopause, there are times where you don't use progesterone. So I'm not going to get into all that right now. The point is that we all have these hormones. There are other hormones too, insulin, we can go on and on. But when we're thinking about eliminating, when people are talking about eliminating gender-affirming therapies, gender-affirming care, please realize that a lot of people taking gender-affirming hormones, and you're looking at one. We have to stop thinking in this binary or these limited ideas and terms. And yes, trans folks are a very small percentage of the population at large. But those folks who, regardless of the medicine that they take, the therapies that they use, people have been people forever. Like, silly. And people are a whole range. And non-binary people, I said I wasn't going to talk about non-binary people, but non-binary or two-spirited or whatever, terms that there are for differences in folks have been since forever. We just have the medicines that help us. So as a late perimenopausal person, I will tell you, looking at the accessibility that I have right now to get my gender affirming therapy is remarkable. And I am so grateful for it. And I know that the generation before me, my mother's generation, had their gender affirming therapies taken away. That's called the Women's Health Initiative. And women did suffer. They really did suffer from it. The constraints that are put on for gender affirming care for men, and we're talking about trans men, and we're talking about if you don't know, the term is cisgendered male. cisgendered men. They are folks who you're born, remember, sex assigned at birth, and then you look like that, and I'm a cis female. Anyway, there are these constraints with testosterone being a controlled substance because a couple people done fucked it up, with steroids, because testosterone's a steroid, but, weightlifting and all that stuff and sports use. And we're not talking about that. We're not talking about these outliers, but I'm just telling you, when you are thinking about limiting gender-affirming care for people, know that it has been limited before in our history, and people suffered. And it's not the people that you're fighting about. It is about your mother, your grandmother, your sister, even your daughters. So I wanted to say, when we think about gender-affirming care, know that gender-affirming care is all fucking genders. I want gender-affirming care, and you are not taking that shit away from me. Last thing I want to say about this, or I probably should have said this before, it is about having that choice and knowing that maybe gender-affirming care for me may not look like the gender-affirming care that you need. Because maybe you're listening to this and you're a menopausal person, or you've had health struggles and hormones are not appropriate for you. That's fine. And I'm not saying that everyone needs to be on hormones, right? But you'll find what affirms you and who you are and how you identify. Even when you are a hetero, whatever. So let's kind of think a little bit fucking bigger about this and see that there's more that connects us than divides us. I'm probably not going to step off of my soapbox. I could tell you that I'm never going to get political again, but I'm probably going to get fucking political. And it may be just like this. Anyway, that is, now you know something about my private parts of wellness. And that's me. I'm using gender-affirming. So, until next time, let me know what you thought. Send me, talk to me. Let me know, because I'm curious. What do you think? But if you disagree with me, I mean, fine, whatever. I don't give a shit, honestly, because it's the truth. It's the truth. Okay, bye. I'm done. Thanks for listening to the Private Parts of Wellness. If you enjoyed this episode, please subscribe, leave a review, hit the bell if you're watching it on YouTube. If you've got a question or an idea, you can leave it in the comments or reach out to me. I'd love to hear them. Until next time, embrace the magic and take care of your private parts.